It is our great pleasure to welcome Dr. Trana Hussaini to the Canadian Liver Foundation's LIVERight Health Forum Ask the Expert series. Dr. Hussaini is a clinical pharmacotherapy specialist in liver transplantation. She is a pioneer in the pharmacy profession in the area of liver disease and has single-handedly raised the awareness of the importance of liver disease in pharmacy. Today, her topic is medication and your liver. Please join me in welcoming Dr. Trana Hussaini.
Thank you for joining us, Dr.
Of course,
Hussaini.
my pleasure.
Now, your liver is one of the body's most crucial organs. Unfortunately, many drugs can put a strain on it. So, Dr. Hussaini, what is drug-induced liver injury, and what drugs can commonly cause this?
Great question. Drug-induced liver injury is a term that is used to describe a situation when a commonly used medication causes harm to the liver, which is unexpected. Your liver is what processes and removes chemicals, medications that are ingested. And sometimes these chemicals or medications are directly toxic to the liver, or in the process of biotransformation and metabolism, some byproducts can form that they in turn can cause damage to the liver. Now, broadly speaking, drug-induced liver injury is divided into two categories: the intrinsic or direct, or the idiosyncratic. Intrinsic and direct, these are reactions that are predictable, dose-related, and often occur within hours or days after exposure to certain compound. And the biggest example of drug-induced liver injury that falls under this direct category is Tylenol or acetaminophen. Tylenol, given in therapeutic doses, is exceedingly safe. Now, when either inadvertently, when patients take more Tylenol than it's recommended, what happens is Tylenol in escalating doses can cause liver damage. Other examples of this intrinsic drug-induced liver injury are aspirin, cocaine, and some of the chemotherapeutic agents. Now, unlike direct or intrinsic liver injury, then you have the idiosyncratic liver injury. And these are really the unpredictable situation where a drug in itself is not really toxic to the liver under normal circumstances, but sometimes in special circumstances when there's an interplay between patient factors and environmental factors, these compounds become toxic to the liver. And usually there is a latency period. So exposure could have happened days or sometimes months, and then you don't see the effect until a long time after. And these are the ones that are a little bit more difficult to diagnose. And a lot of antibiotics fall into that category. Some anti-tuberculosis medications such as isoniazid also fall in that category.
Okay, thank you.
Of course.
Very comprehensive answer. Okay, so the second question is, how is drug-induced liver disease diagnosed? Are there any symptoms that one can watch for, and what are the treatments?
Yes, excellent question again. The diagnosis of drug-induced liver injury is really one of exclusion. So either the patients have symptoms, and these symptoms could be yellowing of the skin or the white of the eyes, which we call jaundice. They might have pain in the right upper portion of the abdomen. They might have dark or tea-colored urine. And or they might have just non-specific symptoms such as fatigue, malaise, decreased appetite. So either these symptoms instigate an investigation, or their physician will see an abnormality in liver enzymes or liver function tests. And once their injury to the liver is detected, then commonly the physicians will start the whole workup, which could include more blood work, some imaging, and in rare cases, maybe a liver biopsy. And once all other possible causes of liver injury is ruled out and there is a history of exposure to certain type of medications, then the diagnosis is made. Fortunately, the liver has an incredible capacity for regeneration. So the first thing which should be done is to stop the offending medication. And majority of patients do improve with time. However, in certain rare circumstances, when the damage is quite substantial, patients progress to what we call acute liver failure. And these patients are incredibly ill. They need to be referred to a liver transplant center promptly for close observation. They might need a transplant, and there has been cases of death due to drug-induced liver injury.
Wow. What are some risk factors for drug-induced liver injury?
That's a good question. Again, the severity of drug-induced liver injury really depends on a variety of factors. It could be an interplay between environment or also the patient factors, such as, does this patient have a history of liver disease? So patients who have severe liver disease, such as cirrhosis or steatohepatitis, which is a form of fatty liver, these patients are more at risk for further injury from other substances, such as drugs. The other risk factor is age. As we age, our liver's capacity to break down compounds and substances decreases. And so that creates a situation where the liver and our body is exposed for a longer period to these potentially toxic substances, and that leads to more injury. Women, in general, are more susceptible to drug-induced liver injury, and for biological reasons, we metabolize substances a bit at a slower rate as compared to men, so that becomes a risk factor in itself. And finally, there are some genetic factors that predispose one to sustaining an injury from toxic substances. The environment interplay is really important. For example, Tylenol or acetaminophen, there is a maximum dosage of 4,000 milligrams per day, but if a patient is malnourished, or if they are fasting, or they are a regular consumer of alcohol, they are at higher risk of sustaining liver-induced injury, drug-induced liver injury due to Tylenol. So they have to consume substantially less amounts in order to stay safe.
Okay, great, thank you. Of course. Okay, so the next question is very interesting one, I think relevant. There are many vitamins, dietary supplements, Western Chinese herbs, all claiming to be natural and beneficial to the liver and for liver health. Do they work, and do they have side effects? Are they safe to take?
Yes, I get asked this question quite a lot, and I can assure you that there are no dietary supplements or natural herbal products that have proven efficacy to benefit the liver, or an array of different claims that you often see on the labels or advertising. The issue really lies in the fact that natural health products and herbs are really not regulated by Health Canada. Their manufacturing or marketing is essentially, there is no oversight. So anyone can make any claim, and there's no quality assurance procedure put in place that will ensure that in fact the health claims are true, and B, whether what is claimed on the label is what is in the bottle. So this is a huge problem, and you contrast that to prescription medications that go through years of clinical trials. It starts in drug discovery and preclinical, and then they go through phase 1, phase 2, phase 3 clinical trials, and even after they're brought to the market, they undergo this post-marketing surveillance and pharmacovigilance, and these are the times that often we discover these rare side effects that are not picked up during clinical trials. There's no such thing with herbal or dietary supplements. They're simply treated as food products, and there's no oversights. Now, the issue is that people feel that these medications are natural and therefore they're safe, and their usage has increased dramatically. And similarly, the incidence of drug-induced liver injury due to herbal products have increased. It is estimated that almost a third of all drug-induced liver injury in China are directly related to traditional Chinese medicine. And in North America also, the percentage is rising. So I would ask that the public be aware of the fact that these medications, these herbal products, their efficacy or safety remains untested, and we simply don't know. And in our program, in fact, we've had a few cases of patients who are otherwise healthy and they want to remain healthy, so they take these natural health products, and we've had a few cases of patients presenting with acute liver failure. Some have passed away as a complication of that, and some were transplanted. So it is a very significant issue.
Thank you. So on a little bit the flip side of that,
Yes.
Sometimes one may have to take a combination of different prescription medications. So for example, medications for diabetes, high blood pressure, high cholesterol, for heart disease. Should one be concerned about liver damage from taking a variety of medications? And how can one minimize the risk of liver injury when you are on multiple medications?
Again, excellent question. Although one cannot really say that, guarantee that if you take this combination of medication, you'll never develop liver injury. I mean, the risk is always there. But I want to stress that that risk is extremely rare. The idiosyncratic liver injury is anywhere less than 1 in 10,000 of patients exposed to a medication. The key is that if you follow the instructions of your physician, if you take the medication as recommended, and then you remain under the guidance of a physician who will monitor you periodically, even if a liver injury does happen, it will be caught, that offending medication will be stopped, and in most cases, patients recover really well. So the fear of these idiosyncratic liver injury should not prevent people from getting appropriate therapy for their chronic health conditions. Certainly, if people have diabetes or high blood pressure or high cholesterol levels, they need to be treated for those, because the consequences of these untreated chronic medical conditions are far worse than the potential risk of idiosyncratic liver injury.
Great, thank you. The next question is, what and how many medications are expected after a liver transplant?
Yes, so right after liver transplantation, obviously the medication profile is very complex, and it is several medications, but the good news is that these medications will be tapered over time. I think initially for liver transplantation, they received 3 immunosuppressant medications, which we will taper over one of them over the next 3 to 4 months. And then they also require some anti-infective, antibacterial, antiviral medications, just essentially trying to minimize the side effects and the potential for infections. Because right after a liver transplant, people are incredibly immune suppressed. But by 1 year, most of our patients are maybe on 2 or 3 medications if all goes well. So yes, initially there's going to be many pills to take, but it's not forever.
Great. So to expand on that a bit on immunosuppressants, this member of the public is asking, what are some of the side effects of immunosuppressants after transplantation? Can I stop taking my immunosuppressant medications? And what happens if I stop?
Yes, so there are side effects associated with immunosuppressants, and not everyone experiences them. But one of the medications that we use commonly is called tacrolimus. It's essentially the backbone of immunosuppression in all solid organ transplantation. And tacrolimus can cause, a bit of headaches and tremors. It can be hard on the kidneys, but these patients are monitored very closely. We adjust their doses, we listen to them, we try to mitigate the side effects. There is another medication called mycophenolate, and that can cause a lot of gastrointestinal side effects, nausea, diarrhea. Again, they're under our care. We try to do our best to mitigate this situation, adjust the dosage, or change the medication. And finally, prednisone. As you know, there are many side effects associated with prednisone, such as high blood pressure, high blood sugars. Sometimes it can cause osteoporosis and softening of the bones. But the good news is the prednisone, we rapidly taper it off, and patients only are on it for maybe 3 to 4 months. Now, although we minimize immunosuppression as patients move away from transplantation, it is not recommended to stop immunosuppression after transplantation. Patients need to take their prescribed anti-rejection for life. And the reason for that is that there isn't a test who's going to tell us which patient has developed tolerance, which means they've accepted their liver as self and they're not going to reject, and which patients are going to reject. Now, liver is the most tolerogenic organ that can be healthy with minimum immunosuppression, and we do our best to only give enough immunosuppression to prevent rejection. But no one would recommend stopping immunosuppression altogether, because the allograft is foreign body, and your immune system at any time can recognize it as such. It will attack the liver, and it will cause at times maybe irreparable damage, and the liver is lost and patients go into liver failure. So patients are recommended to take their immunosuppression as prescribed. And also I wanted to mention that not everyone requires the same amount of immunosuppression. So sometimes patients compare, so-and-so is on this much, how come I'm on this much? So it's all very scientific, and it depends on every person is different.
Great, thank you. So this is our last question, and earlier you were mentioning that generally up to 4 grams a day Tylenol is quite safe unless you have certain other conditions, in which case you need less. So this question is Tylenol safe after liver transplantation?
Yes, that's a great question, and I get it all the time. When patients, before they receive their transplant, they have cirrhosis, which is one of those risk factors that actually increases the risk of drug toxicity. So when patients have cirrhosis, it's not recommended for them to take Tylenol. But after transplantation, when they have a nice brand new liver, there is no issues with Tylenol as long as they stay within the recommended dosage. In fact, we quite like Tylenol. It's a great pain relief medication, and taken appropriately is very safe.
Great. Excellent. Well, thank you so much. That's the end of our questions.
Okay, great.
It's lovely to have you.
It was my pleasure. Thank you for the invitation. Thank you.